Well, thank you for the opportunity to share some thoughts which have been gleaned over the years in my association with Wellbeing in Schools Australia. And I was very pleased to be invited and honoured to talk on the social determinants of student health, which is why there's that subtitle, and to discover a whole lot of information that I was unaware of previously, even though I was promoting social determinants of health in general without much success to the government. So it was really quite an eye-opener, and I just want to share perhaps a bit of a synopsis of things I gleaned. But before I do that, I would like to acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of the country where I reside, and which is very close to where I took this photo. I want to also pay my respects to Noongar elders past, present and emerging to guide our transition to the symbiocene. And to get there, if we follow this holistic social and emotional well-being model from First Nations people, which has been adopted around the country, I think we'll have a way of getting there, even though it may take a while. And it in there is clues to what I determined in my social determinants focus are two words that really summarize it. I mean, it's a very broad topic, but there's just two words I think just summarize what it's all about. So the clue to those words are in that diagram, but I will reveal them later. Meanwhile, I need to acknowledge the fact that we're in this pandemic and already seeing the signs of the fourth wave, which, as you see there, seems to be going to be continuing to increase despite the fact that the waves of the pandemic will be diminishing, and we'll be left with this legacy of damage to our mental health. And there's always the risk, of course, another virus coming along, just adding to this burden. And there's a burden already which seems to have been forgotten for a while, that this generation may be the first in history not to outlive their parents. And that's a quote from probably a couple of decades ago, when it started to be realised this was emerging. And so we have several pandemics on top of one another, and when they join forces, it's been described as a syndemic. So one pandemic can be greater than the sum of the parts of other pandemics. And this is a concept that's unfamiliar to many of my colleagues when I mention it. And obviously it's a cause for concern for students, and not surprisingly, they're calling for help. So students need all the help their schools can get. And parents are aware that it's not only school kids, but also those in primary school as well are also being stressed out by the situation. And that reinforces the importance of Wellbeing in Schools Australia to build resilience in the schools to shield off some of these stresses. And this is from a Kaiser Family Foundation study. So what can we offer as medical professionals to deal with this situation? Well, sadly, not a great deal, when the paradigm is and has been for a long time, as you can tell by the age of these pictures and that poster, that the belief was and still is that all you got to do is detect physical defects and encourage their correction, that's how you'll get to improve health. So how on earth can you, with that level of thinking, how can you cope with a syndemic? The other light bulb moment I had after hearing this quote from Hildy Gottlieb, and the fact that the health system is really focused on the -1 side of the equation and has got no or limited capacity to be creative. And that sort of gels with this spectrum from illness and disease to health and well-being, and with the there was an attempt by Aaron Antonovsky, who is the developer of this concept of salutogenesis, and really didn't get very far, which is not his fault. It's the fault of the fact that there's profit to be made from illness and disease, and not so with health and well-being. And that's one of the reasons why you'll have in the leafy green suburbs, you'll have plenty of specialists, but where the need is greater, there's less, which is called the inverse care law, which is alive and well in Australia. So the education has much more to offer, as you can see from this Robert Wood Johnson Foundation infographic. And the key being that you live longer, the more education you have, and there's a dose effect. And one of the reasons education is better is because it's targeting the whole population of children, as opposed to the health system, which is only seeing those that front up. And it has an impact across generations, because hence contributing to the infant mortality rates. The better education mum has, the less chance of having a problem with problems with the kids. And there's also a dose effect with reducing risk. So the more education you have, the less chance you have of diabetes, heart disease, being overweight, and with smoking. And a dramatic demonstration of the impact of improving the percentage of adults with some college education is what was available online. Unfortunately, no more, because the app you had to have to make it work is no longer available. Fortunately, I happened to capture an example of New Mexico, and there's nothing like this in Australia that I'm aware of. And you can actually change the percentage of adults having college education to see what influence it has on the number of deaths averted. And if you look at the bottom right-hand corner, you can see how many deaths are averted. And I would suggest that the health system probably wouldn't be able to achieve as much as that in a year if they had that opportunity to do so. Although that's not, this website's no longer available, I discovered another one called Gapminder. And when I flick to it, you'll see the impact over time of education. And it starts with women 65 years and older. And of course, this was a website developed in the United States, but you can choose which country you want. And here we go with men 65 years and older. And just think about, if it was mean years in hospital, would that have the same influence on life expectancy? I don't think so. This is an interesting study by Galea et al. To show that if we had social factors on death certificates as opposed to what you may see, like renal failure and unintentional injury, etc., and if you compare with some of these social factors and also compare with the interventions which occur, there's heaps of interventions in relation to the physical conditions, but a distinct lack in terms of these other issues which are ongoing and very influential on health. And probably the most critical one relating to the commonest cause of death, acute myocardial infarct. And look at the impact of low education And so that also points to the fact, well, how do we change that situation? High education. And by doing so, sure enough, it shows up in the statistics that the better the education, the longer you live. And of course, the reverse is true. If you don't finish high school, then you can expect a lower lifespan. And yet that doesn't get the attention it deserves. This was realised by a previous Commissioner of Public Health in Los Angeles who said this. Now, can you imagine our equivalent, our Chief Medical Officer, saying that? Well, he's very busy at the moment, but he probably wouldn't say it because of this other problem that I was suspicious of, and that is that prevention is not high on the agenda of the government. So I wanted someone else to confirm that and investigate it. So I asked the College of Physicians, their policy and advocacy branch, if they could investigate. And they sent me a copy of this Productivity Commission report. And they also referred to some studies that were going on, which haven't been published, but at least in the Commission report, they acknowledge that schooling has something to do with chronic disease, but that's about as far as it goes, and it's a big report. But they did quote someone who said this. So their conclusion, this college policy advocacy branch, the conclusion was, and I quote, well, I'll let you read it, which has enormous implications in terms of if you're looking for funding to do important preventative work, such as Wellbeing in Schools Australia, probably Commonwealth Government's not the place to go. More likely perhaps states and philanthropic organisations, where you can use this economic argument, which sometimes is the lever as opposed to the sense in having kids graduate from school to get better jobs and therefore better health. So how do we keep kids in schools? Well, that's a massive topic in itself. I just thought I'd scan to see what's out there, and came across this article. And in it, it comes up with these 5 strategies. And I thought it was interesting that 3 of them are the same, creating a positive climate. So that's what we need, climate change in schools. I'm going back to the Robert Wood Johnson Foundation, and there's still, even though they're not working on this topic, that all this information is still available there. And this important point that the parents' education is linked to children's health. No surprise there, but it just doesn't seem to be translating into policy in this country in particular. The other thing which is interesting is to see that they can do scans on babies and see that there's a difference, even at very early ages, between those who are born in high socioeconomic areas compared to those in low areas. More pointing to the fact, where do we start in terms of trying to improve the situation? Another clue to that is the Early Development Index, which we trialled in North Metropolitan Perth quite a few years ago now. And that cohort was followed up by the Telethon Kids Institute to see if there's any correlation between the Early Development Index scores and NAPLAN scores. And sure enough, the implications being that if you want to improve education of children, it has to begin long before school. So a bit of a summary so far, and this is a good way of summarising it from this New South Wales document. So, what are those two words? Well, here's a clue to one of them. And the clue comes from Roger Holdsworth, who is our friend of WISA and an advocate of a student voice. So students have more control of their lives, and what goes on in schools are going to be a much more powerful position to feel that they're in control of their lives. And that's one of the key components of the social determinants of health from certainly my perspective. And the other one is the sense of belonging, along with those other senses which Roger has pointed out there, quoting Nancy Phillips. But that's how I would summarize it: sense of control and sense of belonging. And if those two criteria are met, then you're pretty well on the path to having a really good social determinants of health and longevity. I usually end on a slide, this quote of Nelson Mandela, but the fact that quality education is one of the Sustainable Development Goals links to a very recent development, and that is the launch of child and all policies by the Lancet and WHO and UNICEF in April of 2021. So if Australia was to adopt this similar concept, I think that would have enormous implications for anyone who's working in the children's services space. And this is a graph taken from that Lancet report, and I think is very useful because you can actually consider what interventions are going to have a positive impact, and it's good to focus on the positive, as I said at the beginning, as opposed to the thankless task of trying to address all those issues below the line. And clearly, Wellbeing in Schools Australia has a major role to play in those years, which are represented there on the graph. And of course, nurture as well, a very important intervention to lift the curve and improve the well-being of children now and in the future. And the other thing which is came across as a result of the child and all policies, and I wasn't aware of until I heard about the former, and that is that Wales is the first country in the world to develop a Wellbeing and Future Generations Act. And again, that incorporates the sustainable health goals and is certainly something that will be good to emulate. England is trying to at the moment, and I suspect others will follow. It would be good if we were able to do that, and I'm considering setting up or re-establishing the Alliance for Future Health Incorporated, which was developed originally in 2000, launched by Professor Sir Michael Marmot. And unless anyone else is going to do so, then I'm thinking we're going to have to establish this alliance again. And if anyone's interested in being part of that, that's my email address. But I just, seeing as I've given health a bit of a bad rap, I thought pretty good idea to take health out of that title and change it to this